And welcome to OVID Technologies. I'm pleased to introduce you to OVID HMS, our comprehensive hospital management system that we have been developing and continuously enhancing since 2018. So it has been 8 years. When we started building OVID HMS, we had one simple vision. Hospital software should grow along with the hospital. It shouldn't force hospitals to buy everything on day one or completely change the way they work. Whether you are a doctor starting your first clinic, running a diagnostic center, managing a pharmacy, or operating a large multi-specialty hospital, OVID HMS is designed to adapt to your requirements. One of the biggest concerns we hear from doctors is, will I have to implement the entire software from the beginning? The answer is no. You can start just with one doctor and simply manage patient registrations, appointments, consultations, electronic medical records, and billing. As your practice grows, adding more consultants is just a matter of creating new user accounts. When you decide to start your own laboratory, we'll enable the lab module. When you decide to open your pharmacy, we'll activate the pharmacy management. When you open your radiology or imaging center, so those modules will be enabled as well. So if you start to happen to add one more branch, we'll just add that branch and you just can start operations from there. No need to purchase another software or anything. So you can manage both the branches or even 10 branches using a single login. And so this is the software that you are going to see. So this has all the modules, OPD appointments. So this is for the doctor, and you get a front desk from where you can operate everything. And then we have this billing module, we have the insurance, we have OPD. You can manage your own list of doctors, and this is all the patient management. Though most of the operations can be done with a front desk, so some specialized operations you'll have to go to that particular module and do. And this is the consent forms, and this is the IPD module, this is the pregnancy, this is the MLC and deaths, this is the operation theater, this is the facility, this is the inventory, pharmacy, so radiology, referrals, and this is the business reports, and this is related to dental labs. So this software covers almost all the modules, and this includes even the HRM, the accounts, and attendance. So everything comes with a single software. So our goal is to have a one software which will make your hospital go paperless, and you can manage your entire data using a single software, a single screen. So this is basically a web-based software, so you can either use it on the web, or if you go to your Chrome, you can click this install icon, and then it will open as an app on your desktop. So you will get a link to it, and you can directly open it from your desktop. And if you want to know more about the software, visit our website. So this is our website, ovid.in. There under the products you'll have our hospital management software. So and if you want to know more about us, you can always definitely contact us. And if you want to register for this software, click on sign up and just fill this form. So like thousands of others, you can also start using HMS. And then this also has a app on which can be used on Apple iPad, and we have a separate app for Android tab. So you'll get the same user experience, be it the web or the tab or the Apple iOS app. So another advantage of this OVID HMS is that it's completely web-based. So whatever data you see, it is going to be real time. The moment someone registers a patient in the front desk, the doctor can see the patient and their appointment instantly on the screen. So whether you are using Android tabs or iPads or web, every data can be instantly accessed from anywhere, and the doctor doesn't have to be in the branch. They can be at the home, and before they start off for work, they can simply log in and see what are the patients that are waiting and the appointments that are in queue. And they can even see the appointment history, or if it is case of a large hospital, they can see the surgeries that are planned, and they can go through all the surgery details, and they can plan or read for the surgery before entering the OT. So, and one more thing is, we don't restrict the number of user accounts. So every member of your hospital has will be getting an individual login. So doctors, nurses, receptionists, pharmacists, laboratory technicians, radiologists, account staff, administration and management all can have separate accounts. Each user is assigned a specific role with carefully controlled permissions. That means every person only sees the module, screens and information required for their job, helping improve both security and operational efficiency. Speaking of security, protecting hospital data has always been one of our highest priorities. Healthcare organizations trust us with some of the most sensitive information imaginable, that is, the patient medical records. Since OVID HMS was first introduced in 2018, we are proud to say that we had no known data breaches, ransomware attacks, or cybersecurity incidents affecting our customers' data. We continuously invest in building a secure, reliable, and dependable platform because we understand that hospitals operate around the clock and depend on uninterrupted access to their information. Today, OVID HMS supports clinics, diagnostic centers, specialty hospitals, and multi specialty healthcare organizations, bringing patient care, clinical operations, and hospital administration together on one platform. Our philosophy is simple. You just start small, use only the modules you need today. As your hospital grows, simply activate additional modules and add more users and branches. You never have to replace your HMS because your organization has outgrown it. And we take the feedback from our customers, and as and when they ask for new feature, we take some time and we do implement the new features at zero additional cost. We designed OVID HMS to grow with your vision. In the upcoming videos, I'll be introducing each module individually and showing you how it solves real-world challenges faced by hospital every day. Thank you for watching, and we look forward to being a part of your healthcare journey. Thank you.